Okay, so hello again, everyone. I am excited to teach you today about remote therapeutic monitoring and how it can help you both support better patient outcomes and get reimbursed for work that we are often already doing in our typical day-to-day as SLPs. Quick disclosure here, I am the co-founder and CEO at IndieAid, which is a software that we will discuss in a portion of today's presentation. Additionally, all of the information that is shared here today is publicly available and is included here for informational purposes only. It does not constitute legal or billing advice. These here are today's learner outcomes. My overall goal is to educate you on remote therapeutic monitoring and the clinical application of it, with a bit of the nitty-gritty related to the code so that you have a well-rounded foundational understanding of this reimbursement pathway. We can think of today as like an RTM for SLPs 101. So if you are a little bit more familiar with the pathway, this will be a fantastic refresher, and then we'll get into some clinical implications and how to best implement it and how you can implement it with one of the software solutions that we will show today. And then, like I mentioned earlier, we will have plenty of time for Q&A. So again, today we're going to talk about the core concepts and clinical rationale for remote therapeutic monitoring in the field of speech language pathology. We're going to talk about how you can streamline an RTM workflow. So RTM is short for remote therapeutic monitoring, for those who aren't familiar. From patient setup through data monitoring so that it integrates easily into your daily practice. And then we'll also talk about those key CPT codes and the related requirements to engage with this reimbursement pathway. Now, here we're going to review something that we all know, our typical speech therapy process in outpatient and private practice settings. So we first got our initial evaluation and goal settings. Then we move on to ongoing treatment, which is usually weekly or at most usually twice weekly. The third crucial piece, and I already gave you a little hint here, the third crucial piece for patient progress and success is, drumroll please, this carryover. We all know that seeing our patients 1 to 2 times a week is such a small amount of time in the grand scheme of things. There are many more hours outside of our sessions and other settings that our patients need to be able to practice in order to carry over their progress to their everyday life. So, my next question for you all is related to how right now you are sharing those home programs or therapy activities with your patients. I'm going to launch that question here. So, how do you currently share your home therapy activities with your clients or patients? And you should be able to select multiple, possibly. Mainly those printed handouts and worksheets, got email, text messages. It really varies, I see. Okay, great. Very good. And lots of printed handouts or worksheets, I see. Okay. Now, next question is, do you currently have a reliable way to gain insight into how often those patients are doing those assigned home programs? Here's another poll for you. So really we want to know, like, are they doing these activities? And do you have any way of showing or of figuring that out? And whether they're actually doing them correctly, do you have any way right now of knowing what's going on at home? Very good. Okay. All righty. Thank you all for your responses. This is where remote therapeutic monitoring comes in. So, remote therapeutic monitoring is the use of qualifying technology to track and monitor a patient's progress, adherence, and response to therapy outside of sessions. So, when we think about some of the things that we are already doing that might fall into these categories, I'd love to see anyone come through in the chat. What are some things that we're already doing as clinicians to help keep our patients on track between sessions? And based on that last one of those responses, I know that many of you are sharing those therapy activities. Anything else? That's the big one. sharing our therapy activities is often how we are already trying to do our best to keep our patients on track between sessions. We're creating and sharing those home programs. We're printing out and sending home therapy activities. We are sending a text or an email or scratching information down on a scrap piece of paper at the end of a session so that the patient doesn't forget the education or tasks that we provide them for that week. We're doing what we can to ensure carryover right now, but there's something missing. How do we know that these patients truly understand how and why they're going to be doing that specific exercise? How do we know they're going to be doing them at all, and how often they're getting to them during their busy session, during their busy week between sessions? So some of these things that we're already doing can include sharing those home programs, and technology can really help us with tracking the engagement with their home therapy activities. Technology can send patients reminders to do those activities. It can allow patients to access their home program from anywhere and ask questions of the therapist right when those questions come up, rather than waiting a week, not continuing to do the exercise, and forgetting what the question even was when they show up back at the clinic. So technology can help with tracking that engagement. Patients can log their progress, their symptoms. So if they're experiencing pain during some exercises of theirs, they can log any questions, ask any questions from home as well. And then you and the patient can communicate about their progress, adherence, or response to therapy outside of sessions. All of this is part of remote therapeutic monitoring. So RTM enables consistent, ongoing support and care plan adjustments as needed between sessions and gets you paid for it. With the right technology, RTM benefits patients, therapists, and the practice as a whole. Now, why does this matter for the field of speech language pathology? Outside of the fact that we're already doing much of this, and if we can get reimbursed for it, we should. RTM acts as a bridge between those therapy sessions and the home environment. It supports adherence to home programs. So, as we know, based on research, the more practice, the better outcomes we see. It also provides documented evidence of between session clinical work and patient response. So all of these things, again, that we are doing, this documents the patient's response to our efforts. Now, RTM has 3 code sets. So we've got kind of a theme here today. We're going to think in threes. The first is a one-time code that reimburses you for getting the patient set up with the technology and educating them on how and why it's used to keep them on track with their therapy progress between sessions. So it's just for the initial setup and patient education. Then the second code set is related to you supplying that patient with the technology. So when we're thinking device supply, it is software as a medical device. So it's not any kind of physical device that you have to provide the patient. It is software. So the second is related to supplying that technology and it actually being used rather than set up and forgotten. So some examples here are you can assign home programs with automatic reminders via that technology. The patient then engages with what you have loaded for them, assigned to them, and they can mark those activities complete. They can report on any progress or symptoms they're experiencing from home, and they can also ask any questions. That's all related to the device supply and use. Next is reimbursing you for the time that you spend in managing that patient's remote therapeutic monitoring. So the time that you spend reviewing that patient data, how many times did they actually complete their activities this week? The time that you spend in communicating with the patient about their progress, adherence, or response to therapy between sessions, and the time that you use RTM data to inform care. So some very quick little examples about what that might be is if a patient is not doing their activities and you ask them why, it could be because they seem too challenging or they forgot how to do them or they think they're doing them incorrectly. It might be the case where you need to kind of reel it in terms of how much you are assigning them at home. Or maybe they are doing their activities and you see they're checking them off daily, or they do it for the first couple of days and then it seems a little bit too easy for them. So then you know it's time to ramp up everything that you're sending home from that for them. Now, like many of you, I have worked with families who are juggling a lot between sessions. I've worked with older adults, individuals with complex medical needs, and caregivers who are managing a full-time job in addition to caring for a loved one. I knew there had to be a better way to support our patients to make progress outside of sessions. So, all the way back when I was in grad school and then post grad in my clinical fellowship, I sought to develop a platform that acted as a simple yet effective therapy management tool for them while serving as a convenient way for us as clinicians to stay in touch and share therapy activities digitally. Now, knowing that many patients and families might have difficulty with technology, we aimed to first research our individualized aid to ensure user friendliness for all patient populations, clinicians, and families. And this research has been presented for a few times now at ASHA by the wonderful research team at the University of Washington. Now, when I first heard of remote therapeutic monitoring, you can imagine I instantly saw how it could be a way for us as SLPs to support our patients beyond the time that we have together each week and be reimbursed for that support. So, our company switched gears to be a qualifying remote therapeutic monitoring platform back in May of last year, and we've been connecting with clinics ever since. So, how does remote therapeutic monitoring actually apply to your day to day as a clinician? And what does it look like with IndieAid? We're going to go through a clinical workflow example next, guiding you through what it looks like to engage in RTM with the IndieAid platform. Now, before we get there, we're going to go through a quick refresher on RTM. The definition of it again is using qualifying technology to track and monitor a patient's progress, adherence, and response to therapy outside of sessions. Those qualifying activities can be tracking engagement, patient logging their progress, symptoms, their questions from home, and then communicating with the patient about their progress, adherence, or response to therapy outside of sessions. So here is a detailed clinical workflow of how this works with IndieAid. You add a patient to IndieAid and educate them on how and why it is used to keep them on track outside of sessions. When they receive your invite via email, they'll set their password and they'll log in. IndieAid is a web app, which means the patient does not have to download an app from any particular app store and can engage with the platform on any device that they already have. So after adding the patient, you will see them pop up in your dashboard. And this is a little bit of a snippet from the dashboard that you will see. Now, next, you can click on a patient to enter their IndieAid app and add the therapy activities that you would like to assign. When you're adding a therapy activity, if you're creating something like functional phrases for voicing exercises, for example, instead of writing on a piece of paper to send home with the patient or sending these via email, which can get jumbled up and lost amongst others, or typing it out in a Word document, which is what often happens, that you then have to print out and just to find out that the printer is broken that day, you can simply add these directly into IndieAid. And as soon as you hit save, you know that the patient has those exercises that you're adding. Now, if you do happen to have any previously created attachments or PDFs or Word documents or even images or videos, you can also quickly upload those right here. Now, within this same form that'll pop up when you click this button, you can add those activities to a schedule, which will then send the patients reminders at the designated time to complete those activities. On the patient side, they can check a box, they can mark that they've completed those therapy activities, and they can also add any notes. So this can be any symptoms they're experiencing, any questions they have about the activities that they are assigned, any kind of patient-reported outcome measures. All of this can be added on the patient side, including, you'll see here that this says there's a recording. So patients can add any photos, any videos, any voice recordings from home while they're doing their activities, or if they are in a super realistic setting and trying to figure out if their voice is loud enough, for example, and maybe they're enjoying a meal with their family for the first time after a stroke and having a feeding tube or something. So there's lots of clinical applicability of when the patients can share those wins at home with you, but also when they can ask any questions, share any kind of frustrations, or if they're not understanding an activity, so that you can help them through that, possibly before the next time you see them again, so that no progress is lost. Now, as the clinician, you can easily monitor that patient's progress, adherence, and response to therapy outside of sessions with this platform. A couple of ways to do this as examples are by toggling to see the daily home program completion and reviewing any kind of patient added notes. So, you as the clinician can come into your platform and be toggling backwards, see exactly how many times that patient completed that therapy activity that week, see if there is a pattern in which activities are they completing and which aren't they. Are morning times better than evening times? Maybe we need to switch everything to one time a day. That is something that you can make care plan adjustments based on what you're seeing in the patterns. And you can communicate with patients about, so I saw that you were doing one activity rather than all three. Is there anything that we can do to support you in actually completing those activities, or any questions we can answer, etc. Now, you on the clinician side will be notified in your NDA dashboard that a patient has added a note for you to review. It looks like this little purple sticky note icon above their name. You'll click on their name just like you would any typical EMR chart to go to their notes section and review what they have added for you. And then you can reply to them. So by clicking on any message in this notes section, a little messaging window pops up and you can message the patient back and forth about this particular topic. Overall here, that was your typical clinical workflow. So as a reminder, again, you're going to set up, you're going to add the patient to Indie and educate them on how and why it'll be used to keep them on track between sessions. Number two, you're going to engage them on the platform. You assign those individualized home programs just as you would any other way, except now it's in one streamlined spot for your team and your patients. The patient receives those reminders to do those activities and engages to ultimately support better, faster progress. Next, your clinicians check in on patient progress, adherence, and any kind of reported symptoms. They can communicate with the patient prior to a session, at the end of a session, between sessions during their canceled visits to manage that remote therapeutic monitoring. So, as a refresher, typically, now this is like really applicable in our speech therapy world, where we're usually at the beginning of sessions or while we're on the way back to a session, we're asking patients like, how did those home programs go this week? How many activities did you do? Did you have any difficulties? And at that time, a lot of times patients are like, good, or yeah, I did them. And we don't really get much insight into what actually happened at home. We don't know if they have questions. Sometimes it's hard for them to remember if they did have questions come up when they were trying to do those activities. So this is something that'll give us insight into what is going on in the moment, and give a little bit of more accountability for those patients and families to actually do those activities at home and be more involved in their care between sessions. So when you're usually asking those questions at the beginning of the session, that can count as remote therapeutic monitoring. Same thing when you are communicating with a patient about their care between sessions the next time at the end of the session. So the next time you come and see them between now and then, you want them to do XYZ activities. And you can also engage in remote therapeutic monitoring during canceled sessions. That is one implementation glory of remote therapeutic monitoring. Many practices specifically enjoy that piece. Now, finally comes the documentation and billing. So these codes, what's one thing to note is that they are not session codes. So this is not something your clinicians have to report on every single time they see the patient. For most clinics, billing once per month for the prior month's activity is what works most efficiently for them. So let's take a look at the numbers. How big of a financial difference could this really make for your clinic? As I mentioned earlier, there are 3 code sets within the RTM code series. So we'll go through each one individually. The first one is related to that patient setup and education on how and why it is used outside of sessions to keep them on track. Now, that reimburses at about $21, and this is national average reimbursement for Medicare. So, most commercial insurances, just a quick side note, most commercial insurances are recognizing these codes as well. It does vary state by state, so I can't say a blanket. These insurances do recognize them across states. So that's something that we can talk about in a meeting. But also then the one that does not reimburse for these codes nationwide is Cigna. Otherwise, most, again, commercial insurance programs are recognizing these codes. And then Medicaid is starting to recognize these codes more and more across the country. But these rates right here are what is national average for Medicare, since that is the only blanket nationwide insurance. And they're the ones who created this code set. So the second code set is for the supply of that remote therapeutic monitoring technology and for the use of it over a 30-day period. Now, you'll notice a couple of things about these codes, and the number one thing is that they are related to specific body systems. This can be a little bit confusing because not all of our patients can fit into these current categories. We are hoping that they expand them in the future, and there's lots of advocacy going around on surrounding that. So we do, though, treat patients related to the respiratory and musculoskeletal systems, and there are cognitive behavioral components that can be really big parts of our therapy for certain patients. So thus, these codes are billed on a case-by-case basis. If you have a true language patient, for example, you would simply bill the initial setup, and then you would also bill for your time. And then these codes would be billable for anyone who, let's say, swallowing, voice, these codes are billable for those patients. So now you'll notice that there are different codes related also to 2 to 15 days of activity or 16 to 30 days. This is because previously, prior to 2026, all of the codes used to be 16 or more days was the requirement, and these were the only codes in existence. Now, as of January 1st, 2026, they have added 3 more codes that are for less days of activity. So if there are 2 days that you have supplied that device for monitoring and actually used it with the patient, there has been actual data transmitted between you and the patient for at least 2 days, then you can get reimbursed the exact same amount as it is for if it was 16 to 30 days. The third and final code set in the Remote Therapeutic Monitoring series is related to the time that you spend in monitoring or treatment management services related to remote therapeutic monitoring. These codes are billed as timed codes, and so you'll see here there's the first 10 minutes and first 20 minutes. These codes are either or, again, in 2025 and before then. So this entire code series started in 2022, but up until January 1st, 2026, there were only these 2 codes related to time. So you had to hit at least 20 minutes of monitoring and engagement or management services that month in order to bill for it at all. This year, they have added a 10-minute code. So this time that you're spending in that patient account and engaging in remote therapeutic monitoring, communicating with them about it, adds up incrementally throughout the entire month. I'll show you on the next screen. We are tracking that for you automatically, so don't worry about that. But this is where you can see then if you only hit 10 to 19 minutes, for example, you would bill this code. And then if you hit 20 minutes or more, you're going to bill this 98980 code. And every 20 minutes, so full 20 minutes that you hit after that, so if you engage for 60 minutes, for example, you would be billing 98980 once and 98981 twice. So you can see how the more time that you spend in these remote therapeutic monitoring management services, the more you are billing, and it can be extremely beneficial for your clinic. Now, IndyAid makes this simple. So I mentioned that we are tracking all of this. This is a little bit of a snippet from our platform for you that you would see your dashboard of all of your patients. We are tracking those active days for the device supply, and we are also tracking all of your clinician time spent in those platforms. Now, here, we are going to take a look at what remote therapeutic monitoring can actually mean for your practice. So these are projections based on the number of patients that you might be seeing, and per patient, FYI, That's these numbers here. And then we just showed examples of additional numbers of patients that you might be seeing at your practice. So you can calculate exactly based on the national averages and if these codes are successfully billed, that's what it would mean per patient for your practice. Now, thinking about this first month, there is that one code, the initial setup and patient education, that is always added in month one. Thereafter are the ongoing codes. And so that's why this month is a little bit higher because you're setting them up on the platform and get, again, that it's about $21 national average reimbursement. And then ongoing are these codes. So annually, and this is if you're seeing those patients annually, this is what remote therapeutic monitoring could do for your practice, depending on how many patients that you see and how many codes you bill. You'll notice down here, these were calculated based on just the 10-minute code. So this is kind of the bare minimum for if you're actually hitting 10 minutes with each of these patients. If you hit 20 minutes, that code was about $25 more of reimbursement. And then same thing for every 20 minutes after that was another like $39, $40 that would be reimbursed. So you can see how this can make a really big financial difference for your practice, as well as making a huge difference for the progress your patients see between sessions. So it is time to get reimbursed for work that you are already doing with IndiAid Remote Therapeutic Monitoring. Now I'm going to tell you a little bit about the IndiAid difference here. We, as a company, we get what you do. So I am the co-founder of IndiAid. So we're SLP founded and we're SLP led in the support as you get started and your ongoing success with IndiAid Remote Therapeutic Monitoring. Ease of implementation. We have a really flexible platform that is designed to fit extremely well into your existing clinical workflows. And then we also have a true partnership that we aim to have with each one of the practices who signs with us. So we've got a collaborative approach for shared success in both our pricing and in our entire onboarding and customer success process. So thank you again for your time today. I am Alyssa Antcliffe. You can find me on LinkedIn. I'd love to connect with you. You can also find a free RTM download on our website, and I believe we'll be sharing that in the chat with you. So you can go to our website. There's a free download on there. There's also a bunch of other information. There's an article on our blog with all of the 2026 remote therapeutic monitoring updates if you want to check those out. And finally, if you are a practice owner or a director who found all of this conversation interesting, I would love to walk you through what IndiAid RTM could look like for your specific clinic. So you can schedule a meeting to learn more and get started here. Even just 15 minutes of your time can really show you how smoothly IndiAid can fit into your operations to make a big difference, a big impact on both your practice and your patients. I'm going to leave this up for just a second, and I'll also share in just a minute, I will share that link in the chat. Now, here are references. There's lots of resources out there. I am very happy to share them with you related to remote therapeutic monitoring. And finally, we are going to go through one last poll question.